All right, everyone. Today we're going to talk about sodium. I will do the electrolyte series, probably 2 weeks of sodium, 1 week of potassium, and 1 week of calcium. Because calcium and potassium is nothing interested to talk about. Uh, my teacher usually say that if you know sodium, you know medicine. So if you're on internal medicine and you know sodium real well, you know everything about internal medicine. So because literally people just have too many sodium disorder. So a couple things that I want to talk before we go into this is sodium is water. So disorder of sodium is disorder of water. So wherever sodium go, water follow. You know that? You know that basic principle in biochemistry? Yeah. And what happened when water follows sodium into the cells as well, right? So the same thing happened when sodium leaves the cells, water follow it. So the cell becomes smaller, okay? You all hear me talking? Nobody missing any part?
You got it.
Yeah, so what affects sodium? You guys know?
ADX.
Drugs, kidneys, a
Hormone.
lot of things can affect sodium. Yeah, glucose can even affect sodium in some way. You know, if patients have diabetes, what's a symptom of diabetes? They go to the restroom a lot, so they're losing water. So their sodium in the body will increase, right? Sometimes there's two types of diabetes: the regular diabetes and diabetes insipidus, which is the disorder of water. Yeah, but that's next week. This week we just talk about simple sodium stuff. So, do you guys know about the formula calculate? Do you know what do you know about osmolality and you know about osmolality? What's that? You know what osmolality is? Nobody knows what osmolality is.
We do study it on the
So technically,
physiology.
osmolality is salt. Let's just tell you, if you have high osmolality, high salt. Low osmolality, low salt. Okay? Technically, that's all it means. I'm simplified it to the simplest term. High osmolality, very high salt concentration. Let me type it in, so just in case you don't hear what I'm trying to say. High osmolality. So high osmolality is high salt concentration. Low osmolality, low salt concentration. Why this is important? Because it determines how much salt you have in your body or in your urine. Okay, it's very important because when we talk, remember I talk about sodium. It's a disorder of water, and if you have high osmolality, that means you have low water concentration. If you have low osmolality, high water concentration. You need to know the correlation. Low water. So I type it in the chat just so you guys can have some idea what I'm talking about. And it's really easy to get confused on this, so stop me if something going on. Okay, one more thing that I want you guys to know is let's roll down to, okay, where is it? All right, it's not there. So you guys know how to calculate osmolality? We're gonna do some calculation today. Okay, who know how to calculate osmolality?
You mean the calculation of serum osmolality, right?
Yes, serum osmolality and
Actually, it depends on the sodium concentration.
Yes.
Mhm. Serum glucose
Mm-hmm.
and urea.
So, do you know there's two
Exactly.
times the sodium
Mhm.
plus glucose divided by 18
Mhm.
plus BUN divided by 2.8.
1.8.
Is 1.8 or 2.8?
Sorry, 2.8.
2.8. Okay.
Mhm.
I thought I was wrong for a second, but I'm not. Okay. Make sure you record that formula down, okay? Serum osmolality equals to 2 times sodium plus glucose divided by 18 plus BUN. You know what BUN is?
Blood urea nitrogen,
Blood
right?
urea and nitrogen, okay?
Nitrogen.
Vâng, you learn all this yet?
Yep.
Yes.
Okay, good. I thought I'm talking nonsense and nobody understand what I'm trying to say. All right, so let's go to case one. Now we have enough information. Let's go to case one. All right, somebody read the case, please. I
Okay.
try to see the whole thing, but my screen is so small and everything is back up on my screen. Okay, read the case, please, Nguyen.
Okay, so let me read. 25 years old athletic Caucasian female comes to the emergency department with the chief complaint of headache, diarrhea, and shortness of breath for 2 days. Her vital sign is 106 per 60 millimeter mercury, 98 degree, and heart rate is 108 beats per minute with 98% oxygen at room air. Her BMI is lower than 19. Physical examination reveals dry mucous membrane and slow skin turgor. Her laboratory value reveals sodium concentration is 128.
Mm-hmm.
Kali is 3.4.
Potassium.
Potassium.
Potassium, sorry. Potassium is 3.4 millimole per liter.
Don't
Right?
worry about unit right now. Just read the number.
Blood glucose is 90, and urea is 28. Urine sodium is 45. Urine osmolality is 100, and a fractional excretion of sodium is 1%.
Okay, before we jump to the question, let's discuss the patient first. Because I think with electrolyte, you guys need to think a little bit more than just read the question. So what does patient have? What do our patient have? Last week we talked about signs and symptoms. So what do our patient have? What's the chief complaints?
Headache,
That's the
diarrhea,
symptoms.
and shortness of breath.
Headache, diarrhea, and shortness of breath. For how many days? Is this acute or chronic?
Acute.
Acute, 2 days. All right, Vâng. What else that you see when this patient have?
Well, I think that the important point is the dry mucous membrane and slow skin turgor. About the laboratory value, the concentration of sodium is lower than normal.
What's normal?
155 to 145.
135 to how many?
145. 45. Oh wow.
Oh, that's 135 to 150. You know why? How I remember this? Because the normal concentration of potassium is 3.5 to Right. So you can easily remember potassium and sodium together, but just take off the ones. They're very similar.
Yeah.
Of course, different countries have different guidelines, but in America, 135 to 150 is considered normal. And potassium, 3.5 to 5.0. How do I remember this? I just take off the 1 in front of the sodium and put the dot in between, and then I got the potassium. Now, we're not going to talk about chloride because that's a different stuff. So, what's normal glucose? It's okay. 90 is really good. Right?
Yeah.
Yeah. So that's good. I don't remember what normal is. That's why I asked. So. Is BUN 28 normal?
Oh, no, it's higher, but I forget the normal range.
Okay, anyone know what's the normal BUN level?
BUN.
It's 28 or something. I just forgot it.
It's okay. Not everyone remember the
Yeah.
normal. In general, around 7 to 20 is considered normal, depending on patient history. Okay, if patient have history of something, then maybe the 20 value is not normal, but 7 to 20 is normal. Okay. Urine osmolality. What's normal urine osmolality? You know?
I remember
Technically,
that
it's dependent. So we don't really pay much attention to that value, but it's dependent on the patient. Okay, what else? That you just talk about the lab, but what else? There's one thing that's important on the patient history that you guys totally forgot.
3 is athlete.
Vital sign. What about the vital sign? Is the vital sign fine?
She has a kind of high heart rate.
Okay, she got high heart rate, right? Nobody pay attention to this. Like, vital sign should be the first thing you gotta look at. Blood pressure good? Pressure a little bit low, right?
A little bit.
Yeah, so.
Actually, it's still in the kind of normal range, right?
Yeah, it's still normal, but it's still low, right? What's normal blood pressure? Okay.
It's lower than 140 per 90 to 90 per 60.
Yes. Well, yeah, it's still within normal limit, but along with the physical exam, it's kind of low. But yeah, it's not that low to critical, but it's still a little bit concerning. It may play a part in the history. And the age, 25 years old, athletic.
Aesthetic.
Okay, that's
So
very
we have
important.
it is tachycardia.
Yeah, athletic with tachycardia. Was it normal for athletic to have tachycardia sometimes, or it's just dependent?
Yeah.
No, I think for the athletic people, they will have bradycardia if we compare to the normal people, right?
Yeah, really. Their heart rate is sometimes lower than normal people. Their heart rate at baseline is lower than normal people because their heart adapted to exercising. So that's why this is very high for the athletic. So what about BMI? BMI good?
A bit skinny, right?
Right.
Yeah, athletic, skinny, low sodium. Tell me something. What's your differential? What do you think? Why is her sodium so low?
128. It's not too much low.
Yeah, but it's still low, right?
Maybe cigarette. Dehydration.
Dehydration, that's one. What else? What is athletic usually used to lose weight, you know?
Um, diuretic.
Too much.
Diuretic abuse, that could be. What else? Do you think she have a tumor? Should we talk a lot about cancer?
Maybe.
Headache? Headache? Diarrhea? She could have a tumor. Cancer should be always on differential. That's what my teachers say. But probably not. Alright, so let's calculate her serum osmolality, because any problem with sodium, that's the first thing we should do. Calculate serum osmolality. So let's calculate that. Anyone have a calculator? Oh, you guys don't need calculator for this. Okay, what's 28 times?
It is
271. 271, right?
Yep.
Plus 28 divided by 28. I mean 90 divided by what? What glucose?
Martin,
I mean 271 is the serum osmolarity.
Oh, okay, yeah.
That's the result,
I thought
right?
that when you said sodium, I was like, that's a little bit concerning. All right, so, but let's do the calculation now. So like 2 times sodium. Sorry, I'm trying to write on my mouse, and it's definitely not a good idea. Plus glucose divided by what?
18.
18?
Yeah.
You sure? Okay. Plus BUN divided by
2.8. 2.8.
2.8. So all this number is really good to calculate.
Yeah.
All right, it's come out to be 271. All right. What's the value that we compare with? What's the number?
280.
280. Good. Nguyen seems like to memorize the stuff, huh? Vâng, you know it's 280, right? Just
Well, I remember that it must be 275. But I'm not sure.
around that. Yeah, let's just use 280 because in America we use 280 too. So
Yeah.
let's go by 280. So what's the next steps? So if it's low, what do you think she has? Will she have true hyponatremia, or she have fake hyponatremia? So if the value is less than 280, is low, she got something called hypotonic. Good. Hypotonic hyponatremia. Okay. If the value is high, she got something called
Hypertonic.
hyponatremia. See, it's starting to get confusing. If the value is equal or normal, which is 280 to 285, that's the normal, then she got isotonic hyponatremia. Which those two we talk about next week. Today we focus on hypotonic hyponatremia. Okay, because that's, and next week we also talk about one more cause of that. It's very complicated. Okay, how do I erase everything? I don't want to erase everything. So whenever I move with me for some reason.
You just screenshot it first and then.
Okay, hit save. Well, let's just clear that because we already discussed all of that. All right. Question. What's the most? Okay, sorry. Vâng, read this, please. Why am I reading that? I'm not supposed to read that.
Alright, the question is, what is the most likely cause of this patient's abnormal laboratory values? A. corn syndrome. Dehydration. C. SIADH. D. Congestive heart failure. E. Renal failure. F. Diuretic abuse.
Okay. So, any ideas what she may have now that we talk about it? You can always let me write some down over here. So we want to pay attention. We know that she have hypotonic hyponatremia. What else do we look at? What about urine sodium? Was urine sodium normal?
No, it's
What's the normal value of urine sodium? So whenever we use 20 to indicate. So if urine sodium is more than 20, okay, then now we start to look at urine osmolality, okay, because urine sodium more than 20, that means you have a lot of sodium in your urine. So your kidneys filtered all those out for some reason, okay. Now, what about urine osmolality? That's 100. So that could be high or low. It's not really matter, but let's just say urine osmolality is normal. Okay. So what do you think she has?
she has some problem with her brain.
Would dehydration causing this urine to be high? Let's talk about the most simple cause, dehydration. Would dehydration cause the sodium in the urine to be high? Physiologically,
Lower. It's lower than the urine.
it should be lower because your body will try to keep all the sodium to keep yourself alive, right? So your body is amazing. It tries everything to keep yourself alive. So if you're losing water, which is dehydration, your body will keep the sodium. Okay? So we know that dehydration is not the cause, so B is out. What about SIADH? What SIADH?
It's kind of syndrome of inappropriate anti-diuretic hormone.
Okay. What do you see with SIADH?
Increase the level of ADH.
Okay. The problem doesn't mention ADH, right? So it's probably normal. But
So it means that.
But in order to determine that, we look at the urine osmolality. Usually with SIADH, urine osmolality will be a little bit higher than 100.
Mm-hmm.
Could be lower. But so what's the symptom of SIADH? What's the patient will have? Does the patient have any symptoms suggesting SIADH? Do they pee all the time? Vâng, you know about SIADH?
Well, in SIADH, the hormone, the ADH is secreted more than normal. So yeah, it leads to the decrease in the concentration of sodium in the serum.
That's right.
Yeah, and sorry, and the serum also. Oh, I forget this word. Also,
So you determine SIADH. Yeah.
Okay. Yeah.
You need
what do
to
you say? What is
say
it?
what? The serum osmolality that we calculate, 271.
Yeah, but in the SIADH, I think that it might be lower than normal because the concentration of sodium is lower, so it leads to the low of the osmolarity in the
That's
same.
right. Good. And
Oh.
also the urine osmolality will be higher than normal. Okay? Because what ADH do? Just think about what ADH do. ADH poke the hole in your kidney, bring all the water back. So if you don't have a lot of water in your urine, that means you have high salt concentration in the urine. That means your urine osmolality will be really high. Okay? It all makes sense, right? If you know about what ADH do, you know if you have really high ADH, your kidney will take all the water back and lift all the salt in your urine, which will be high osmolality. So in this case, it's not constant. Well, it's not SIADH. We talk about con in a minute. What's con syndrome?
Also the same.
Hyperaldosteronism, something. That's what I heard.
It's a
Hyper.
natremia.
It will cause hypernatremia, right? Is this hypernatremia to you?
No.
No?
Oh,
Okay, good. It's hypo. Does the patient have renal failure by any chance, to say? You think the patient have renal failure? Not really.
No.
All the labs still look fine, and it's only 2 days, so we can't really tell the patient has renal failure unless this getting worse and worse. Yeah.
Mm-hmm.
What about congestive heart failure?
No.
Vâng, you seem like you confused. Any confusions or any
sorry,
question?
What did
Say
you
what?
say? What did you say? I'm sorry.
Oh, I say, do you have any question so far?
Well, I'm a bit confused that you just say that in SIADH the urine osmolarity may be higher.
Yeah, it should be higher. You know why?
Maybe I missed it. No.
Okay. So ADH,
Yeah.
technically it poke hole in your kidney. So let's say this is your kidney right here. That's the glomeruli. Sorry, I'm just drawing that. So it's poke a hole in this. It's increased the potassium sodium channels or whatever. That's very complicated to discuss. So technically water will leak out of the kidney.
Yeah.
So that's water. Okay, it's leaking out. So ADH just poke a hole, and it's poke many holes, so more water come back to the body. Everything just go through beside water. So it will increase your osmolality. Remember what earlier when we talk about osmolality? Osmolality just means salt.
Yeah.
So if it's low water coming out,
Osmolality.
that's high osmolality.
All right, I got it.
You got it? You sure?
Yeah. I remember
cool.
that you said it. You said it.
I say this 1,000 times because it's very important. Okay, it's very important that you guys know this concept because it's all right. I have to draw because I like drawing. Make me understand stuff. Don't worry, the kidney is very interesting. There's more stuff to learn about the kidney. All right, so it's not renal failure. What about congestive heart failure? Would you see that the congestive heart failure? Does this patient look congestive heart failure to you, just in general?
Not really.
Not really. So what's congestive heart failure? What's the serum osmolality of congestive heart failure? High, low, or normal?
Sorry.
It's low. Okay, but to determine the patient have congestive heart failure, we look at their physical exam to determine if their body has a lot of water. Dry mucous membrane. Is this a sign of congestive heart failure? Was the patient with congestive heart failure have dry skins and dry mucous membrane? Probably not, right? They should be wet because they have a lot of water in their body, so they should be wet. So their mucous membrane will not dry, and when you pick up their skin, it returns immediately.
Yes. Like
Okay, so this is not
oxygen saturation.
Yeah.
98%.
Yeah, and also 98% oxygen. That means their lungs working fine. There's no congestive heart failure here. So we can clear congestive heart failure out. So what left? Okay, I can move this. Probably diuretics abuse. What diuretic does you think she used? Low sodium, low potassium. Furosemide, right?
Right.
Maybe furosemide. Okay. Okay, because furosemide is a loop diuretic. It's cause everything to be low. Okay. One way I remembered it is the loop. Furosemide, the loop diuretic. O mean hypo. So it's gonna cause hypo everything. So hyposodium, hypo K. Yeah, it's got hypo everything. So that's why the loop diuretic class cause hyponatremia, hypokalemia. All right, good job. We got our answer. Let's move on to the second case. Sin Pasteur is
what's happening that's she taking the furosemide?
Oh, she just athletic, so she kind of want to lose weight, I guess. She want to lose weight fast, and furosemide help lose body weight by taking all the water out of your body. Most people abuse it in America because they think that they may lose a lot of weight, but they don't know that it's caused their electrolyte to be messed up, and that's how they end up in the emergency department. Okay. If her BMI left below 16, I will keep her in the hospital. Yeah, because it's concerning.